Now, it's World Cancer Day, and new research reveals that 1 in 2 people born after 1960 will be diagnosed with some form of it in their lifetime. At least a third of those cancer cases are due to lifestyle. So are we doing enough to protect ourselves from the disease? Let's speak to GP Dr. Hamid Khan. Hello to you, Doctor. Thank you for joining us on Sky News this afternoon. Are we doing enough to protect ourselves against cancer?
Well, the short answer is no. The vast majority of lung cancers are completely preventable. They're caused by smoking. Colorectal cancer, which is also one of the top 3 killers, as it were, has a huge dietary component in terms of risk factors. And it's well known that the 3 things, smoking, alcohol and having a poor diet, increase your risk of a variety of cancers quite significantly. And I think that's where our focus needs to be. I think our focus is excessively on treating and curing the cancers, which is a good thing to do. But a more efficient way of managing this problem would be to work on health promotion and public health. And that's where I think our focus needs to be as a service, as a nation. And that's where funds need to go as well. We've had huge public health cuts recently, which haven't helped that cause at all.
What can be expected as a member of the public as far as the NHS is concerned, and what can we do ourselves?
Well, in terms of what can be expected, we actually have excellent protocols and pathways for detecting and treating cancer. The National Institute of Clinical Excellence has very clear guidelines for every type of cancer. In England, if you have symptoms which may indicate a cancer, then you will be seen within 2 weeks under the fast track pathway, as it's called. And we have some of the best cancer treatment centres in the world. So in terms of what can be expected, I think we have some of the best treatment facilities and some of the best pathways that exist anywhere on the planet. In terms of what can be done, I think that goes on to a wider question of rights versus responsibilities when it comes to healthcare. The balance between rights and responsibilities will always be difficult in a service like the NHS, which is completely taxpayer funded and which is free at the point of delivery and universal. But in my point of view, from my perspective, seeing patients every day, the pendulum has swung really far too much from responsibility to rights. And I think patients would do well, the public would do well, to think about what they can do to improve their health and to prevent things like cancer, not just cancer, but various significant illnesses like heart disease and lung disease and so on, by improving their lifestyle. Incidentally, I have a lot of patients who I see who have done this. A good example is a patient who I saw recently who had very severe obesity and who wasn't very concerned about it because she thought that she could just have bariatric surgery for it, and that as a result of that it was fine to not institute significant lifestyle measures to reduce her chances of having dangerous obesity. In the emergency department, I see a lot of people who come in inebriated, for whom accident and emergency is almost a default end to a night where they've been drinking a lot, for example. And I have lots of younger patients who expect their health service to keep a diary for them and to call them when they are due to have blood tests and due to have things like blood pressure checks and so on. And what that leads me to believe is that we need to do more to encourage people to actually empower themselves and to take responsibility for their own health. Because as a service and as a nation, we simply don't have the resources to be a nanny state when it comes to health to the extent that we are at the moment. Yes, we must provide what is clinically necessary, but patients must also do whatever they can to prevent themselves from becoming ill and to improve their lifestyles and their health in terms of things like diet and exercise and smoking and alcohol and so on.
Okay, good to talk to you. Thanks for joining us. Appreciate it.